Sometimes patients will come in and they'll ask me whether or not we can just do a neck lift because that's all that's bothering them is their neck, and they point to the area underneath their chin. And if they've had a facelift in the past and their upper face is pretty toned, they might be a candidate for that. But the majority of the time, aging is occurring over the entire face and the neck, and even sometimes the upper part of the face too, the eyes and the forehead and the brow. So we always have to kind of look at each individual person. But the majority of the time, the face and the neck lift, in my experience, are best done together. And one of the reasons for that is anatomically, the muscle that runs up the side of the neck is called the platysma muscle. It attaches at the collarbone and extends up in over the jawline up into the face. And if you're not lifting that up into the facial area, first of all, you're not lifting the fat compartments up higher, and you're not taking the slack out along the jawline very well. You're lifting only in one direction, well, two directions. You can lift medially and laterally, but you're limited on vertically. And the vertical component is one of the most important components of the facelift. So I don't like to do neck lifts most of the time by themselves. However, one exception to that is a younger patient that is really not a candidate for a facelift yet, but they have anatomically an ill-defined neckline because maybe their chin is deficient, or where their hyoid bone, the bone that anchors the muscles of the tongue, sits is down lower, and we're trying to get more definition. Maybe they've got some fat under their chin, so doing a combination of maybe a little bit of liposuction, firming the muscles, liposuction below the muscle, above the muscle, sometimes even maybe taking out some structures under the muscle, and firming that muscle together, and then pulling it laterally and defining the angle of the jaw with a technique. There's a technique called a mastoid crevasse, and when we tighten the muscle down to the tip of the mastoid bone behind the jawline, it can give more definition there. And sometimes a little bit of a chin implant, can also help to give them more projection, which will give them more definition underneath their chin. So that's one example of where we may do just a limited neck lift type of procedure. And obviously patients that are younger, they don't really want to have an incision up the front of their face. In fact, nobody does, but in an older patient, the incision hides very well, and the trade-off for having an incision there is more than worth the minimal scar that they may be aware of. Most of the time, these scars are not visible by other people if the incisions are made properly and the lift is done properly. So it can be more than worth the trade-off. Yeah, the majority of the time, the face and neck lift are best done together, in my experience, in my opinion. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.